Good afternoon, parents. My name is Dr. Brew. I'm a developmental pediatrician. Since we started talking about screen addiction in children, we've had a lot of calls, parents asking us, how do I know that my child has screen addiction? That can easily tell. Of course, if your child is spending a lot of time before the screen, that clearly tells you that the child may develop screen addiction. But for children that have become symptomatic, there's a way we can tell, because they will have developmental delays across all the domains of their development. And to help us look at some of these, we are using the Early Childhood Care and Development Standards, which was produced by the Department of Children under the Ministry of Gender. This document is widely available, and we're looking at a child at 36 months, which is 3 years, who has developmental delay. What signs you can look out for that will make you know that you need to take the child for a comprehensive assessment. So some of the signs are: 1, the inability of the child to coordinate himself. The fact that the child cannot eat or eat by himself, maybe still eating baby food, and the child cannot dress and undress himself. The fact that the child is violent when he's disturbed. He gets unusually angry and very distressed when you take, let's say, something from him, and he can throw things and he can hit people, and he doesn't realize that he's hurting others. The fact that the child may not seek the parents for comfort or distressed. The child would also show no interest in things around him. If he picks a toy, he can be glued to just that toy for a long time and will not want to move from one activity to the other or from one toy to the other. Or when they do, they move very fast, just from one toy to the other. They like to play on their own, and they will not like to integrate with other children. And when you call, they won't tend to look at you, but they would turn when they hear the sound of a cartoon. And so they won't turn to their name. And they avoid eye contact with people. Eye contact means they will look at you when you are talking to them. That's eye contact. They avoid eye contact, or they have very short eye contact. They may have poorly developed speech. They may stammer, or their words are not clear. If they speak, they may have a foreign accent, or they may just repeat words like alphabets and rhymes on and on and on. Then sometimes they tend to speak a lot of words that perhaps may not make a lot of sense. These are examples of some signs that we look at for in children who may have developmental delays. And a child with screen addiction may have some of these. It's important to get the child checked at a clinic. Thank you.